welcome to Ship It All Registered Nursing. Well, today we're talking all things pregnancy and baby. Alright, so stick around. I will be doing a live pregnancy test for you at the end, and I'm sure you want to know if I'm pregnant. Okay, thank you for joining this video today. So today we're talking about pregnancy tests, early signs, and what to expect step by step. So I'm going to be answering all your questions that you have been asking about pregnancy and the signs. So if you're a mom to be, or wondering if you're pregnant, let's go. Okay, so I'll be answering 12 questions, so 12 frequently asked questions that need to be answered. Question number 1: how soon after unprotected sex can a test for pregnancy be detected or be done? So answer for that is fertilization happens within 24 hours after sex, but pregnancy tests don't work right away. We wish they did. They detect a hormone called HCG, which only shows up after implantation of that embryo. So implantation usually happens 6 to 10 days later after. So wait about 10 to 14 days after unprotected sex to take a pregnancy test for the most accurate results. 2: how many days after a missed period should I take a pregnancy test? You can technically test on the first day of a missed period, but for the most reliable test, wait at least 7 days after your missed period. That gives your body, enough time to produce the detectable level of HCG. Next question up: how soon after sex can you test for pregnancy? It takes time, as I said before, for HCG to build up after conception. Testing too soon can lead to false negative, and we don't want that, especially if you're excited to become a mom. Best to wait 10 to 14 days after sex to test, to do the test. What does a positive pregnancy looks like versus a negative one? Okay, my friends. So a positive test usually shows 2 lines. Even if the second line is faint, it is still positive, okay? Negative test shows only 1 line in the control window. Okay? Always read the instructions carefully, because each brand is different and it may look different. It may have something different about it. So it's best to really read your instructions on it. However, for the most part, most of them are similar. Next question: can an ovulation test detect pregnancy? My friends, ovulation tests detect LH, not HCG, but HCG can sometimes trigger a false positive on an ovulation test. Still, don't use ovulation test to check for pregnancy test. Use a real pregnancy test to check for pregnancy. Next question up: HCG level increase per week. Can you tell me a little bit about that? So HCG doubles every 48 to 72 hours. Here's a rough weekly guide, starting at like week 3. 5 levels, maybe 5 to 50. Week 4 to 5, maybe looking at like 5 to 426. Then by the time you get really into week 5, it's somewhere 18 to 7,340. Week 6, 1,080 to 56,500. Your doctor may keep track of your HCG levels. Mine surely did. So I'm sure you'll be doing a lot of blood tests every now and then. Next question: best pregnancy. Someone is asking, what is the best pregnancy test for early detection? Don't we all want to know early? So look for any test that says early result or 6 days or sooner. They may say 6 days or sooner test. Top choice is usually first response, early result, known for eye sensitivity. Digital tests are easier to read, but not always as sensitive. Okay? Next question up: can you reuse a pregnancy test? No. Nope. Once it is used, that's it. It's a one and done deal. One and done. No reusing a pregnancy test. Once it's used, the chemical on the strip have reacted and we cannot reuse it. Reusing it won't give an accurate result, and you want accurate result. Always use a fresh, new pregnancy test. Alright? Next question. Can I get a false positive or a false negative on a pregnancy test? Well, so listen up. Negative are more common, because we test so early sometimes. So negative is more common, but positive is rare. I'm not saying it's not possible, but it's rare because all things are possible. But it's rare because, for example, it may be you can get a false positive, based on, medications. If you had a miscarriage before, your HCG level is definitely still high. So that will cause you to have excuse me, true words. That will cause you to have a false positive. If you have a miscarriage or, a faulty test, because, things are manufactured, things can happen. If in doubt, please, retest and contact your doctor to confirm pregnancy. Someone is also asking implantation bleeding versus period. So implantation bleeding is usually light pink or brown color, more like spotting, but it only lasts for like a few hours to a couple of days. Remember, like a period, for your period, that's heavy bleeding. It's heavier, it's red, like really red, and lasts for 7 days or more. Sometimes, lasts for several days. Some people go to 7, some 5. It all depends on the person. If you're unsure, wait a couple of days and, always contact your doctor. Okay? So, we have come to the end of our questions. And if you like what you're getting so far, remember to comment below, tell me about your experience, share it with a friend if they need any advice about these questions or have any concern. Give the video a thumbs up because this will help to push the video out some more. Also, we're going to jump in to a live pregnancy test. So, let's go. Also, click the link below or this next video so you can get a full step-by-step guide to do a pregnancy test. Thank you for watching. Let's go into our live test. Make sure you collect your urine. So there's 2 options with these type of tests that you don't literally have to drop the urine in. You can pee on it for like 5 seconds only, or you can dip it for 20 seconds only. Alright? After that, we are going to wait 2 minutes to complete the test. So we are waiting and you can see it filling up in there. It's my baby making his noise. While I anticipate another pregnancy test. Let's see. So it's going through. You see the result line, the result section, there's no line. So that means I am not pregnant. So it's taking its time, but we're supposed to wait 2 minutes. So it's just taking a little time to really see. But listen, if I was pregnant, that line would have got blue already. I'm telling you, you don't have to wait 2 minutes. Because I've had the experience. So this is it. You can see the result section. There's nothing. The control center, there is a line. And as I said, if there is no line in there for at least 10 minutes, you know that that result is not good. So here I'm just showing you my pregnancy test that's 2 years old. That shows a positive with both lines. So there's a line in the result line and there's a line in the control. I still have it. So I'm just lining them up so you can see both a negative test and a positive test. All right. Thank you so much for watching my video. I hope this helped you, and click the link for the next video. It's gonna tell you what to expect during pregnancy and all the questions that you have to ask about the signs of being pregnant. I will be answering them. Thank you.